Hello everyone, this is Dr. Ananya. Welcome to my channel. In today's video, I'll be talking about TSH test, that is thyroid stimulating hormone test, and its treatment. Before beginning the video, I'd like you to subscribe to my channel if you haven't, so that I can share all the valuable and useful information with you. First of all, let us know what is TSH. TSH stands for thyroid stimulating hormone. It is a hormone that is produced by pituitary glands. Pituitary gland is present at the base of your brain. A TSH test is a test that measures this hormone. Now, let's talk about thyroid. A thyroid is a small butterfly-shaped gland present near your throat. You may also use your two fingers to palpate your thyroid glands. Your thyroid hormone regulates the way the body uses its energy. It also plays a very important role in regulating body weight, body temperature, muscle strength, and the mood. When thyroid levels are low in your body, your pituitary gland produces more TSH. When thyroid levels are high, your pituitary produces low TSH. TSH levels that are too high or too low may indicate that your thyroid isn't functioning well. Now, let us know what is this test used for. TSH test is a way to know how your thyroid is working. So, why do you need a TSH test? You may need a TSH test if you show any signs or symptoms of too much thyroid or too little thyroid. Too much thyroid is also known as hypothyroidism, and too little thyroid is also known as hypothyroidism. So now let us know what are the symptoms of hypothyroidism. Hypothyroidism or overactive thyroid includes anxiety, weight loss, tremors in hand, bulging near the eyes, puffiness, increased heart rate, and difficulty in sleeping. Hypothyroidism or underactive thyroid includes weight gain, constipation, irregular menstrual cycle, tiredness, hair loss, and low tolerance to cold temperatures. So now let us see what happens during a TSH test. During a TSH test, a small amount of blood is taken from the vein of your arm. The blood sample then is sent to the laboratory, and results usually come in a day or two. So, do you need to prepare for this test? This test is very simple and very quick. It only requires a small amount of blood that is taken through needle. So, if you are only going for TSH test, you do not require any preparations. But if you are taking additional tests, then you may be required to fast for a few hours. Also, if you are under any sort of medications, it's very important to let your doctor know, as some of the medicines can alter the results. So, are there any risks to the test? This test almost has no risk, as it only requires a small amount of blood through needle. Make sure the needle is sterilized and the site is cleaned. So now, let's talk about the results. What do the results mean? High TSH level means you're not making enough thyroid hormones, and low TSH means your thyroid is producing way too much hormones. A TSH test can only tell about the functionality of thyroid gland. It does not explain the reason. So for diagnosing, your doctor may require additional tests, which include T3, T4, and other confirming tests for diagnosing certain diseases, which include Graves' disease and Hashimoto's disease. So, can hypothyroidism and hypothyroidism be treated? Yes, it is possible to treat both the conditions. There are many ways in which these conditions can be treated. If you have high level of hormones, that is, if you have hypothyroidism, your treatment can include anti-thyroid drugs, radioactive iodine, beta blockers, and a surgery. These four methods will help your thyroid gland to stop producing the hormone. But if you are suffering from hypothyroidism, then you might be given thyroid replacement medications. This is a synthetic way to add hormones into your body. Also, make sure you do not try to interpret your report by yourself and start a medication by yourself. Always consult a doctor. A quick reminder, it is very important for you to get tested from a reputed and reliable lab. A link to a reputed and reliable lab will be provided to you in the description below. If you have any questions or any suggestions, please feel free to comment below. Till then, stay safe and stay healthy.